Hi folks, Dr. Ed Beyer here. Today I'm making this video to invite you to a upcoming workshop I'll be holding in my clinic in Tinley Park this Wednesday evening at 6:30 on fibromyalgia, chronic pain, and chronic fatigue syndrome. I'm going to be going over all the underlying causes to fibromyalgia. If you're suffering from chronic pain, chronic fatigue, you have to sleep all the time or your sleep's disrupted, and you've been trying all kinds of pain medications, going to various doctors and not getting answers to your questions, you need to call or text and come to this workshop. It could change your life. I'm also making this video to actually show you a case study of someone who came to one of my workshops on the exact same workshop. Her name is Peggy. Here's Peggy's story.
Hi, I'm Peggy Belanda. I've been a patient of Dr. Beyer's for going on about 6 months now. When I came to Dr. Beyer, I was chronically ill. I had fibromyalgia, Polymyalgia Rheumatica, and I was so severe that I had to stop working and was actually awarded Social Security disability at the early age, late 40s, early 50s. In the 6 months that I've been seeing Dr. Beyer, my health has dramatically improved, so much so that I am full of energy, full of life, enjoying life, and ready to embrace going back to school, finishing degrees, and moving on with my life.
And Peggy, did you find, we identified a lot of the reasons, the underlying reasons why.
Absolutely.
And you've worked with our clinical nutritionist and myself and my son, Dr. Scott.
Absolutely.
Do you feel like you've learned through this program why you have what you have and you can kind of manage your own self?
Absolutely. I've learned reasons why I was chronically ill. I've learned nutritional values to give my body the nutrients it needs to heal itself, and know what to look for with if I start to get a flare of an autoimmune disease, how to handle it naturally and be able to go on in a very short amount of time. So I've had a little bit of a flare in the middle, and they knew exactly what to do, and we put that fire, so to speak, out before it got bad. So.
And you tried some things before you came here too. How'd that work out for you?
Oh my gosh, I was on prescription medications. I'd seen multiple doctors. I was on prednisone for a long period of time, which gave me more medical issues. So I'm excited and happy that I can take care of my body with food, nutrition, and supplements that are good for me, that are actually healing these conditions.
Great. Thanks, Peggy.
Thank you.
Now, as you can see, Peggy's life was in shambles. She was in disability. She wasn't enjoying life. And no one, and she was searching and searching, no one had really gotten to the root causes of her underlying chronic pain and fatigue. Once we did, and we identified them and removed them, it's really that simple, folks. Traditional medicine doesn't look at these things. We do with functional medicine and functional neurology. Once you identify the root causes, then you can go about eliminating them. With functional medicine, we don't care what you have. I don't care if you have fibromyalgia or what you've been told. We want to know why you are chronically sick. And that's what I'm going to be talking about at this workshop. So if this sounds right for you, call, text the number. Hope to see you there this Wednesday.